Remarkable. Truly remarkable. Thank you so much. We're going to move back and forth over the course of the evening from hearing about people with personal experience, people with professional perspective. The next person who I'm going to ask to come up is a colleague, Dr. Jan Malat. He's a staff psychiatrist and medical head of assessment and concurrent disorders, combining addiction and mental illness. At the Center for Addiction and Mental Health, he also works at Mount Sinai Hospital. He's an assistant professor at the University of Toronto and is a certified addiction practitioner. He also has significant responsibilities within the university, and I work closely with him there. He publishes broadly and lectures broadly around addictions and mental illness. Jan, come on up, please.
Thanks, Nolan, and thanks everybody for inviting me tonight, and congratulations to all of you for coming out and taking another step in tackling the stigma, as you're so well aware of. So I'm just going to start with a few questions that I get asked in my practice. I think that kind of captures some of the clinical work. And a common question I have is a patient sitting in my office, and they're kind of bewildered. They're sitting here with me and asking, how did I get here? 5, 10, 15, 20 years ago, they started using somewhat casually with their peers and colleagues. They didn't have any intent to become addicted. They didn't have any intent to ruin their lives. But here they are, shocked that they're drinking daily. These are smart, intelligent, motivated people. But their use has changed, right? It's very different now. They've lost control. They're using more, larger amounts for longer periods. They're unable to stop. Negative consequences are piling up, as you've heard, right? They're neglecting their work, their school, their relationships. The substance use is kind of taking over their life. It's becoming the main and the only activity to the exclusion of everything else. They're risking themselves, they're harming themselves. So it's clear at this point, right, that things are very, very different. That whatever way they were using 5, 10, 15 years ago, it's not how it's happening anymore. So how do they get here? The true answer is there's thousands of ways. You know, we're all vulnerable, we all have a breaking point, and we all can get here and be addicted. I mean, there's some kind of risk factors that leave people a little bit more vulnerable. I mean, that starts with things like family history, and that's both in terms of the modeling and the witnessing, right? Children growing up in families where it's in front of them on the table. I remember one patient who told me she started while it was around all the time. She was 9 years old, there was a joint, she just picked it up. That's what everybody else is smoking, so she picked up a joint. Then of course there's genetics. Genetics play a factor too. I mean, it's well established that certain people, when they take substances, have a very different response than other people. They can feel a very powerful experience. They can feel really good, and initially none of the negative consequences. And that's well documented. So there's some people's brains are different from the beginning. They get all the good without the bad. On the other side of it, there's some populations, particularly in the Southeast Asian populations, where it's the opposite. They use and they feel nauseous and vomit. And so they, no surprise, have a protective factor. So there's family history, there's modeling, as I mentioned. And then there's the trauma, where we talked a bit about bullying. So a lot of patients with addictions grow up in traumatic families and backgrounds, and substance use becomes a quick, easy way to numb the pain. And then there's the vast array of concurrent psychiatric illnesses that patients have, often starting in childhood, as we know, in adolescence, and then the addiction comes into the rescue. I've heard so many times in my office patients say, whatever they were struggling with, social anxiety, depression, attention deficit, low self-esteem, when they first took that substance, whatever it was, they finally felt normal. You know, it's hard to argue with that. It's hard to fight that. And then there's all the other things of exposure, early exposure, peer network. Often people get addicted, they start a relationship and their partner's using, and they just start using to join in, and a couple years later they're in the same spot. So, many different ways to get here, but typically when a person's in my office and they're kind of realize they've got here, they at that point should try to stop for a couple of weeks, and then they come to me and they say, okay, I want to go back to using like I did before. I just want to control like I used to. So this is when we have a bit of a difficult conversation, because to themselves and often to their families, they sound fine. Right? They look well, they sound well, they stop for a few weeks, they're looking good, sounding good, and kind of cosmetically, superficially, everything seems fine, right? The problem is, I mean, addiction is a continuum, but often by the time people get to a point where they've lost control, their brain, as Mullen has mentioned, has profoundly changed. And this is there's many different ways the brain changes. A big part of the brain is to do with the reward system. The reward system is, as Mullen said, a permanent part of the brain that has taught us through evolution to keep repeating things that feel good, and we're programmed to respond to what we call natural reinforcers, things that help us do things that feel good. You know, have friends, have relationships, have sex, raise children, take care of ourselves, eat, right? These things feel good. They're natural reinforcers. The problem is when the substance comes into the picture, it's a little bit like a Trojan horse, because the amount of reward it gives to the brain vastly outperforms any natural reinforcer. The level of dopamine, the level of pleasure, the level of relief is often 2 to 5 times what any natural reinforcer can get. So if a person's vulnerable, a person's suffering, the cascade begins. 1 time, 2 times, 3 times, and you know that every time they use, the brain is being resculpted, and the brain is becoming more and more narrowed and focused for a single-minded purpose, which is to keep obtaining the substance that's producing this. And as the substance kind of grows in importance, all of the natural reinforcers get pushed out, get eclipsed. The brain of an addicted person becomes a very highly kind of lean machine, if you will, for one single purpose. But what usually happens to people as they progress this way, and this is, I think, a common misconception, is that they're not using it for pleasure, usually quite early into the cycle. It really becomes about avoiding pain, that it's not about, I think is one of the myths and kind of stigma is that, you know, addicts, they just want to have fun and have pleasure, and it's very much the opposite. Most people in my office will tell me that the first high felt the best and they've never reached it since, and most of the time, as the addiction progresses, they're just trying to not feel pain. And what started with pleasure very much becomes transformed into desperation, kind of akin to a starving person who is always looking for food, right? Because that whole reward system has become about getting whatever one is starving from and getting this substance. So you have desperation, and then of course we're desperate, we do all kinds of things. We lie, we steal, we commit crimes, and a person isn't thinking clearly, despite can still present very well. And I think here is another kind of contributor to the stigma. I think here's where language fails us, because us not addicted people can talk about urges. We have urges. We, you know, pass a store, see a nice car, see some chocolate, and we can resist some of the time, maybe a lot of the time. But it's really, again, I think it's a misnomer of language to call what's happening in our brain an urge to what happens in an addicted person's brain. Again, the level of intensity of the urge, the cravings, as Mullen said, these are biological, intense experiences that vastly eclipse the normal amount of urges that any of us kind of experience. So it's kind of like comparing a ripple on a beach to a tidal wave. So of course, anybody with this level of urges is going to eventually give in, right? This is what one writer, Mark Lewis, calls ego fatigue. So my patients come to me and they feel very weak. And what I try to tell them is, you're not weak, it's just that your brain is extremely powerful, but powerful in a very unfortunate kind of way. And none of us can resist that kind of power over time. It wears us down. So the part of the brain that has to do with the brakes, with the stopping, the part of the brain that helps us resist urges on a daily basis, that part gets weakened when this is going again and again. The way, again, it's like asking a starving person to keep putting food in front of them and expecting them not to eat. We can override these urges short-term, but long-term, none of us can sustain it with that intensity. Okay, so at this point, if a person is at that sense of acceptance, okay, my brain is different, my brain has changed, okay, I can't control my use, okay, what do I do here? Where do I go from here, right? Okay, I recognize that willpower isn't enough, I can't do it on my own. So this is when we have another difficult conversation. And This is when we talk about making major life changes, as you heard Ori talk about. Forgive the metaphor, but I kind of talk about, I say, okay, this is like you have to do a major renovation here, right? You have to make dramatic lifestyle changes to get this under control, because your own brain just cannot resist and cannot fight all these urges, so we have to make dramatic lifestyle changes. And that can mean a very large number of things. So people have to leave jobs, they have to often get rid of their entire peer network, they often have to end relationships, they going to go get help for the first time, they reach out for help, tell their families, try to break the stigma and disclose, and this can, and they basically have to make dramatic life changes that they have to start leaving no alcohol in the home, you know, getting rid of all the phone numbers on their cell phone to all the dealers, and so on and so on. So it's like a renovation with major scaffolding. But the problem is, right, this can be, some of the scaffolding can feel very humiliating, right? It's kind of like, you know, these are smart, competent adults who sometimes feel like they're wearing diapers, right? So they sometimes have to go and, you know, give a urine sample every few days, you know, just to make sure they're staying sober. They have to give up control of cash and money to their spouses, and they feel like little boys and little girls who've kind of lost dignity and autonomy. But unfortunately, that is the power of the addiction, right? And patients often sit in my office and say, well, why don't I have to take urine tests? Don't you trust me? And I always say, I totally trust that right here, right now with me, you're very motivated, but what I don't trust is the power of the addiction, or what I always say is I have a lot of respect for the power of addiction, and I know that when you leave here, anything can happen, and the relapse can happen. So that's the one challenge, right, is everything they have to give up to make the next step. And then, just to make it a little bit more complicated, getting sober often activates a grieving process, right? You're leaving your, right, Ori talked about he fit in with his basketball group and all these people, he was somebody, he was cool, he fit in. So again, you gotta often get rid of your whole peer network. You have to, as the fog of the addiction clears, the person starts remembering all the things they did when they were using, so again, that brings guilt and shame. And just to make it a bit more complicated, a lot of people with past trauma histories, the traumatic memories from childhood start coming back as the brain gets sober. So, you know, it gets very, very challenging. That's why it's so important for people to have support from friends and community when they're getting abstinent. So, you know, no wonder people are ambivalent about stopping. I mean, it's quite the extraordinary, difficult journey to get to the other side. So it makes perfect sense that people are not going to give up easily or lightly, even though it's causing a lot of pain, because all the challenges they have. And then, so they make these dramatic changes, they get on medications, or they go to AA, or they go to rehab, and they change their lifestyle. They get a few months of abstinence, they get feeling confident, their families get a bit of hope, things are moving forward. And then what happens? Well, maybe they're feeling a little bit confident, and it's been 6 months. I think I can try a little bit and just, one drink isn't going to kill me, is it? So they test a little bit, or they get back working and they get that first paycheck again, and suddenly they have money, or they have a really stressful day at work, or they run into a former drug-using friend. Any of those things, what do we call them, triggers, cues, and very quickly, all that success, pardon the expression, can go down the toilet very quickly. And then the addicted individual, the family, are often discouraged, let down, and this cycle, as many of you know, can go on and on and on, and lead to profound discouragement and shame. So at this point, when a patient is in my office at this stage, where they've had cycles of relapses and discouragement, you know, there's a lot of hopelessness in the room, and the question is often, you know, doctor, is there any hope? Will I ever get better? What is this going to look like? And that's when I have the dialogue with them about recovery. And I'm very clear that, you know, this is defined in the literature of mental health and addiction. You know, recovery is living a dignified life with the meaningful activities despite struggling with a chronic condition. In this case, addiction, right? Recovery is not about how many days of abstinence, how many months of abstinence. Of course, that's the ideal and optimum outcome. But you and I know that not all patients can get there, but what they can do is they can try to fight a battle every day, and we have to look at the little victories. And in the beginning, it often is, okay, you had 3 months, that's great. You relapsed for 2 days, that's a hell of a lot better than relapsing for 2 weeks. And you use this much, which is a lot less than you used last time. Okay, let's try again. Every day you're sober, every day you fight that craving, every day you do something healthy when you have a craving urge, that's a little victory. And those victories accumulate. Just like it took for some people 5, 10 years to get to addiction, it's going to take some time, 5, 10 years to get to rebuilding a new life. And finally, I think one of the really important things I try to convey to patients is part of getting well, part of recovery is trying to fill that void with some meaningful positive activity. And for some people, AA can be a huge part, giving back. It can be, some of my patients say, I say, what keeps us sober? They say, I got a pet dog, reconnecting with family, hobbies. I have a patient who used to be a magician in his 20s, and now he's in his 40s. He's coming back as a magician. So it's whatever they can find and pull back in life, because we part of getting well is we gotta reintroduce those natural reinforcers to the brain, right? The addiction's kind of taken over and eclipsed all the natural reinforcers and kind of put them aside, and part of getting well is really bringing back those natural reinforcers back to the brain to kind of give kind of a life of kind of dignity and to kind of compete with the pull of the addiction. So I'm going to stop here. Thank you very much.